Hi, and welcome to you. This little meditation is for you if you experience chronic pain. Whether you use painkillers or not, whether you've attended a pain clinic or not, it doesn't matter. The key thing is to tune in now and be with your pain. Do the counterintuitive, which is stepping in and being with your pain rather than resisting it. Okay? So make yourself comfortable, back as straight as you can, and feet flat on the floor if at all possible. And then gently close the eyes. Start by noticing how the world is different with the eyes closed. You might notice sounds much more. Tune into these sounds. Notice how they arise in a vast space. And then start by reminding yourself that you're holding this little sitting in an attitude of non-judging. That even means that when the mind describes pain, you go underneath that label of pain into the sensations that are there. So non-judging, and also non-judging of whether you get this right or wrong, whether it works or not. Just experience it. And acceptance, saying yes to this moment, including the discomfort, including the sensation that is constantly calling for your attention. Saying yes to that also, so that is part of this moment. And curiosity. Be curious around how the mind tends to deal with what you're experiencing. And then kindness, compassion, tenderness, loving awareness. For a moment, place the attention in your heart. Be aware of the love that resides in there. If you find it a little hard to connect with, think of something or someone that you love or that loves you. Feel that love. That is the love and tenderness that you hold your experience in. And now shift the attention to the feet on the floor. And then to the body in the seat. And the hands in the lap. Noticing the warmth that's generated between the hands and the body. And also notice the sounds in this recording of the birds outside. And when you do, just come back to where the meditation is at. And now tune into the breath. And just notice it wherever it is most noticeable to you. You might even notice it as a sensation of where the body, or how the body, is being breathed. Just observing it. Gently allowing the out-breath to become a little longer, a little deeper. Just allowing the out-breath to sink into the body. And now tune into the body overall. And start by reassuring the body, dear body, I'm listening. I hear your language. Speak to me. And then be curious around what sensation is most strongly calling for your attention. And now hone right in on that. Be curious around where exactly it sits. The shape of it. Whether it's moving or not. The colour, if it has a colour. The temperature, cool or warm, or just as the body. And see if, when you just tune into the sensation and ask it in kind curiosity, dear sensation, what are you associated with? What are you linked to? Just be curious if some words or pictures emerge. Doesn't matter if it doesn't. If it does, just notice that. And you might link it to something further to clarify your understanding of this, or not. And now go into the sensation with utmost curiosity around what is generating the discomfort, the energy, the sensation. Be really curious and keep drilling down, going into it and into it and into it. When you've realized what is generating, just be with that. You can also be curious to see if there's any space within the sensation. See if you can focus a little on the space. Just breathing in the space of the sensation. And now see it as if the hands, your hands, are cupping the sensation in love. A deep caress. The sensation is being held in utmost acceptance. 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 Love. Compassion. And appreciation. Knowing that the body is speaking to you. And appreciating the dear body for doing its very best. See it as if one of your hands is caressing the sensation, imbuing it with more compassion and appreciation. And now gently breathe in the sensation and out through the sensation. Breathing in to the sensation and out. Now take a deep breath straight into the sensation and a deep breath, mouth open out. Do this 3 times. Now come back to the sensation. It might also have shifted somewhere. Wherever the sensation in the body is most noticeable, that's where you go. Again, hone in on it. Be curious around where exactly it sits, the shape of it, the size of it. Whether it's moving or not. And again, be curious around what is generating the sensation. Step straight into it. In appreciating unity, become one with the sensation. Straight into it. And being in it. And being in it. And being in it. And being in it. See it as if the hand is gently caressing the sensation, imbuing it with love and compassion. If possible, you can also place your hand over the place of the sensation, as close to it as possible. Sense the warmth from the hand. Imbue the sensation with warmth, love, understanding, and compassion. Reassure the sensation. We are safe and all is well. We are safe, we are loved, and all is well. We are safe, we are loved, and all is well. Now shifting the attention to the breath. Just notice it. Notice the breath flow into the sensation and out of the sensation. Breathing in and breathing out. And take a few breaths where you're really allowing the breath to deeply breathe into the sensation. And deep breath out. And again, deep breath in. Deep breath out. And once more, deep breath in. Deep breath out. Now bring the attention back to the sensation. See where it is now. Be curious around the pain level now compared to before you started. Then bring the attention back to the hands in the lap, to the body in the seat, the feet on the floor. Take the hands and rub them together quickly. Place them over your face, feeling the warmth from the hands. Then relax the hands, and when you're ready, gently open the eyes. I wonder how you feel now. You can do this as many times as you like if it's working for you. And if it's not working for you, then be curious about whether there is resistance there, whether you're really going into it, whether you can find the love for it. It's natural that it takes a while to do, that you won't get it first time, that you might even find it irritating. My suggestion is give it a few goes, give it a few really good goes, and you might just find a reduction in your pain.